Welcome back, and thank you for your continued participation in the CKD-EDU study. In this video, we'll provide key points to discuss prognosis with patients. I'll briefly share the latest data comparing dialysis and conservative kidney management, highlighting survival differences. We'll also go over the pros and cons of different treatment options to help you guide patients in making informed decisions about their care. Many patients face a difficult choice. They want to maintain or improve quality of life, but also want to live longer. They often ask, how long will I live with dialysis? Will dialysis improve my quality of life? Some patients don't realize they can stop dialysis if it doesn't meet their needs. Others may hesitate to discontinue treatment, even when it's no longer beneficial. A trial period such as 2 to 4 weeks of dialysis can help patients decide if it's the right choice for them. But how do we determine prognosis for an individual patient? There's no simple answer. Prognosis varies based on functional status, number and severity of comorbid conditions, and frailty. These factors should be considered when guiding patients through their decision-making process. Generally speaking, younger patients with fewer number of comorbid conditions do better on dialysis compared to older frail patients with a high number of comorbid conditions. Let me now present 2 relevant studies on survival differences between dialysis and conservative kidney management. These meta-analyses with bias analyses examine 12 observational studies to determine whether starting dialysis improves survival in adults with advanced chronic kidney disease. Results showed a 53% lower risk of death in those who initiated dialysis compared to conservative management. However, the study relied on observational data, meaning unmeasured factors could have influenced the results. Other study limitations, including heterogeneity and selection bias, often favored dialysis survival outcomes. The benefits are less clear for patients 75 and older due to limited data and the lack of inclusion of frailty as a covariate. More research, ideally randomized trials, is needed to confirm these findings in older populations. Importantly, these meta-analyses showed fewer hospitalizations and better quality of life for those choosing conservative kidney management. This 2024 U.S. study, based on VA data, focused on older adults with a mean age of 78 years. The study was observational, but designed to mimic a clinical trial. Among 20,440 adults followed over a 3-year period, the dialysis group had a median survival of 770 days, while the conservative management group had a median survival of 761 days. When comparing the two groups, dialysis extended survival by 77.6 days, but resulted in 13.6 fewer days at home. So, what can we take away from this? Dialysis does extend life, but often only slightly. Younger patients do better with dialysis. When making treatment recommendations, it's important to consider individual factors like health status, lifestyle, and personal goals. When comparing dialysis and conservative kidney management, both options come with distinct advantages and drawbacks. Dialysis can extend life, but requires a significant time commitment. For example, people choosing in-center hemodialysis receive dialysis 115 days per year. Dialysis may involve frequent hospital visits and often leads to functional decline. It involves surgery for access, transportation to treatments, and potential complications like low blood pressure, cramps, and fatigue. Conservative management prioritizes maintaining function and reducing hospitalizations. Patients generally remain independent longer and avoid dialysis-related complications, but this approach may result in a shorter life expectancy. Choosing between these options depends on individual values, health status, and quality of life preferences. The type of dialysis a patient chooses can significantly impact their quality of life. In-center hemodialysis offers professional supervision but requires strict scheduling and frequent travel. Home hemodialysis provides more independence and may improve well-being, but demands self-management. Peritoneal dialysis also allows home treatment, but requires daily care to prevent infections. There is limited data comparing home hemodialysis and peritoneal dialysis, making individual patient preferences and lifestyle key factors in choosing the best option. Thank you for participating in the CKD-EDU study. Please reach out if you have any questions.